Good afternoon, everyone. My name is Emma Shulock, and today I will be talking about the mental health of college students and how there's a lack of funding and support for it. Approximately 5% of adults 18 or older experience a mental illness in a given year, which is equivalent to 43.8 million people. Mental health remains a growing issue for colleges in the U.S. As colleges experience more enrollment each year, the demand for mental health services and supports increase. Since 2014, total enrollment grew 5%, and by 2018, nearly 1 in 10 students sought help for mental health treatment. Students find it challenging to seek help when not given an immediate response. The need for mental health services rises as we experience the 2020 pandemic and face-to-face appointments become difficult. Through this research, data finds that COVID does affect the mental health of students, the lack of funding for on-campus mental health services remains a growing issue, the appointment wait time grows longer, and anxiety and depression stand as the highest concerns. The 2020 pandemic causes a major disruption in college lives, and mental health becomes affected. The Association for University and College Counseling Center directors surveyed 144 colleges and asked them to compare the first 4 weeks of this 2020 fall semester with the first 4 weeks of fall 2019. The results of the survey proved a 29% decrease in the number of students seeking counseling services, 22% decrease in appointments, and 57% increase in student anxiety. According to the Centers for Disease Control and Prevention, 1/4 of undergraduates, typically between ages 18 through 24, considered suicide within the last 30 days. In a recent poll by the American Council on Education, 53% of college presidents ranked student mental health as a top concern during the fall 2020 semester. Sharon Mitchell, Senior Director of Counseling, Health, and Wellness at the University of Buffalo and President of the association, offers a few theories explaining the decline in demand for counseling. One possibility includes the fact that students taking classes at home may be accessing mental health services locally rather than on campus. The other possibility suggests students at home may be feeling less stress as they surround themselves with family members for support. A survey conducted of 195 students at a large public university in the U.S. concentrates on the challenges to college students' mental health during COVID-19. 138 students, 71%, say their stress and anxiety increased due to the pandemic. 39 students, 20%, indicate it remained the same. And 18 students, 9%, say the stress and anxiety decreased. As shown in the figure, at least 54 participants showed negative impacts of COVID-19 on their health, academic, and lifestyle-related outcomes. Colleges begin to notice the high cost counseling causes them. Harrisburg Area Community College, the largest community college in Pennsylvania, recently announces the stoppage of providing on-campus clinical counseling for students. More college and university administrations say the mental health issues of students exist as one of the most pressuring and costly challenges on campus. Large portions of budgets for four-year institutions go towards mental health services, but the financial strain grows stronger. As the demand for mental health services increases, universities hire more staff to try and keep up. As you can see in this graph, even with the increase in staff, the counseling centers still fail to meet the budgets. This proves the high demand for counseling services continues to increase, and universities need to work hard to make sure each student gets the help they need. To meet the needs of their international students, Ohio State University offers clinical services in 9 different languages. Colleges must not only continue to hire more staff, but hire ones that accommodate to their students so they feel more comfortable to come in for help. The Illinois law was passed last year and requires campuses to boost awareness of mental health throughout college campuses. There's an estimate of $17 to $20 million each year over the next 3 years to fully implement the law. It sets the goal that every school obtains a counselor ratio of 1,250 to 1. Since the pandemic hit, colleges have failed to follow this law, but hope to fully implement it in the upcoming years. As counseling appointments line up, students sit around waiting to get in. According to a report from the Association for University and College Counseling Center Directors, More than 160 colleges and universities reported waiting lists for counseling services during the 2017-2018 academic year. A 2017 report by Stats News finds the longer waiting list taking place at some of the larger universities, including the universities of Michigan, Indiana, and Florida. However, small liberal arts schools also feel the strain of overwhelming student demand, such as Nebraska's Creighton and Minnesota's Carleton College. A sophomore at Northeastern University, Rebecca King struggles through her years at college adjusting to the new lifestyle without her family. Once she realizes she needs help, she reaches out to the university's Health and Counseling Services Center. They tell her she will need to wait about 6 weeks before seeing anyone at all. 3 months later, she overdoses. After years of public efforts encouraging young people to seek help for their mental health concerns and it now finally working, institutions appear not equipped to reach the demand. According to a survey conducted by the Association for University and College Counseling Center Directors, more than half of the students who went to their campus counseling centers reported symptoms of anxiety, 41% of depressions, 34% reported relationship concerns, and 20.5% of suicidal ideation. Depression is a serious medical condition that can affect a student's ability to work, interact with peers, or take care of themselves. In 2017, 16% of college students indicated depression negatively impacted their academic success, and over 24% of students said the same thing for anxiety. The need for on-campus counseling notices an increase, as 75% of the lifetime cases of mental health issues begin before the age of 24, including the stressful years of college. According to the National Network of Depression Centers, the leading cause of disability in Americans ages 15 to 44 correlates to depression, with the disorder affecting almost 70% of the country's population. The need for mental health services will not go down anytime soon. As pressure rises, students continue to experience a new lifestyle, their mental health proves to struggle. Approximately 5% of students, 18 or older, experience a mental illness in a given year, equivalent to 43.8 million people. If colleges become aware of what needs to change, this number will potentially decrease. However, if college campuses continue to eliminate their mental health services, students will struggle to find an alternative source for help. As a college campus, the place students pay to go to and temporarily live for most of the year, it is your responsibility to take care of any and all needs of the students, especially something as important as mental health services. 3 things I've learned from this class are how to look out for and replace the weak words. I not only know what the weak words are, but I know how to replace them with stronger words. I know what it takes to write a correct news script, I know how to write a lead and a tag, and I know what the correct format is. I also learned the importance of multimedia and how much it enhances your writing and gives it credibility. These are all the sources I use for my research. Thank you for listening.